The rate of data that is being consumed and ingested has changed our ability to be smarter in the marketplace. So I see a lot of, data as being the new gold rush.
The one thing that we are really encouraging, and we're starting to see some impact, is that the creative agency and media agency need to work together much more closely than they ever have.
Welcome to Season 3 of the AMM Conversation, official podcast of the Association of Medical Media. I'm your host, Jason Karras. Before we begin this first episode, please make sure and do us a favor by following, rating, subscribing, or sharing this podcast with your friends and colleagues. In this first episode, we'll revisit the highlights of the AMM Pharma panel that I moderated in late October. That discussion featured Jim DeLash and Lori Holland Hancock. Jim's the U.S. Marketing Director of Customer Experience for Vaccines at GlaxoSmithKline. Lori is Director of the Multichannel Integration Team for Oncology at Merck. We started the discussion with Lori providing a state of the medical media industry.
I think the industry is definitely still in a state of flux, and we're still learning how to manage through COVID, but we're doing better with it. And how I see our industry, it takes me back to the days of old where we're really partnering more with the medical community. Not that we haven't in the past, but there seemed to have been a bit of a firewall between industry and physicians. And now, because we're facing this pandemic together, we're really trying to problem solve and come together as to how the best solution for physicians as well as patients. But it is, the virus has its own way of thinking, and it helps us to be more nimble and pivot as states open and close at the same time. And then how do we continue to support our customers through these different ways and be very relevant? I also see, us coming together as an industry that kind of helps solve from a vaccine perspective or a cure perspective of how do we bring our best scientists together and our best minds and ideas in manufacturing, because this is a pandemic that's of global magnitude that we've never faced before, and we have to be within the industry. It's not about one company, it's about us against the virus. So I'm very positive that the industry can overcome this, but it's good to see the collaboration in ways that I haven't seen before.
Jim, I've heard through guests on the AMM Conversation podcast that pharma has become uber focused on targeting during the pandemic. The message, the media selection, recommendations, much more focused than what has been done historically, mainly due to a shifting HCP mindset during this crisis and the pandemic. Can you explain the biggest adjustments you've made this year in response to so many traditional channels being disrupted at once?
The idea of targeting and focusing on certain segments of the population within the healthcare provider community, we've been doing that for a long time. I imagine most marketers are. We're not just going out, broad and general. The benefit you have in marketing to healthcare professionals is we all know who they are. We have a database full of them. We know it's not like consumer marketing where you've got to go find people who have asthma or whatever. It's like, I know who they are. We can focus. I think what things like a pandemic do is accelerate trends that were going to happen anyway. So as rep access becomes limited, now you've got to figure out ways to change your message and get the right message there. So that's what we've been doing more than the media. It's been the messaging that's been changed, because right away you think about, and in my world of vaccines, it's a lot of when you're talking about a preventative message, there's a little bit of fear factor involved. How else do you sell something unless if you don't take this vaccine, this could happen? So you have to be careful with that in a pandemic where things are happening, that could be pretty bad out there. So we've dialed that down a little bit. But as far as the mix of media, we've expanded our efforts, but really not into new media as much as just new messaging based on the segment.
I would definitely agree with what was being said. And I think what has been highlighted here, I think the industry was already going to a more focused shift based on targeting and the HCP mindset. But what I also see is leaders really looking more in a multi-channel or omni-channel space. And how do we now have better cross coordination across channels, as well as, what's going to be our strategy from a pull to a push strategy. And this ability for us to really talk through not just the pandemic, but it also kind of highlights some of the healthcare disparities, and how do we kind of, as was previously said, pivot our message to kind of address some newer situations where we weren't we may have been focused, but we need to kind of elevate that a bit more.
So just to build on one of the things Lori just mentioned about like leadership being more involved and being more aware of things like digital and media, which is, I think, is the case. There's more education required, because one of the things we realized, things like reach. When you talk about reach for the sales force, salesperson reaches the office, they talk to them, they detail it, whatever, that counts as one reach. Well, one email to a doctor, technically that's a reach, but not really. It's not really the same effect. So we try to define things in terms of effective reach, because we can reach everybody. Like I said, we have a database, we can send an email to everybody and reach them all, but that's not really going to matter that much. Where if you had enough sales force that you could reach everybody that you needed to as often as it would have likely more impact. So it is about redefining some of the terms and explaining kind of what we've been learning over the years through testing and models and so on, to say it's not like reach and frequency like it. It's different in this space, and offline and online have to work together to come up with the right experience, which is different than in person.
So let's dig a little deeper. And Lori, what's different about as you start preparing for 2021? What's going to be different?
Making sure, getting back to the comments around reach, but it's also about reach and engagement, and really thinking through your digital investment with a purpose and opportunity, and how are you laddering that back to your marketing objectives and strategic imperatives and communication objectives. And I think it's more around, are there newer channels in 2021 where our customers have now pivoted to, where we may not have either been or been as deep into those channels? And how does our strategy pivot to meet the customers of where they're going to find educational need?
One of the more practical things that's different for us is the alternate plan. So you have a plan based on an assumption of, COVID's going to be here through the first half of the year, or whatever it is, whatever the assumption is, you got to assume something, or it's going to be business as usual. And then you have sort of the backup plan. You have key markers to say, okay, as of February 1, if nothing's changed, we're going to go to plan B, or, whatever it is. You have to kind of do double plans almost, depending on the product. So we have some products that are, more relevant for college freshmen or students, young people graduating high school, going off to college. Well, if they're not going off to college, or they're going to be at home going to college, that's different. They're not going to, so we have to have plan B. If they are, then it's kind of back to, and then there's a timing element. So all that stuff, you start with a base of assumptions based on what we know today, and you modify it, and you have alternate plans. It's kind of what you normally do too, but the plan B is a lot deeper than it would have been otherwise. I think that's the big change for us. And, we all know how it's not that easy to develop creative quickly. So you have to really plan ahead. And, you also don't want to make it so generic that it could be used anywhere, because then it's not going to work. So there's a lot more work in that kind of in the planning phase. But I really think that's a good thing, though. I think it's forcing you to think about things you wouldn't have otherwise thought of.
On a little bit more granular scale for our target audience, what is changing about your work in working with agencies, consultancies, vendors, et cetera?
Our way of approaching, a multi-channel or a customer experience plan is like always, you start with segments, you go to creative messages, you go to channels, and then you go to the website. That's the way we approach it. And that's some kind of steps. Along the way, you look for the big idea. Where's the big idea? Is it going to be a new media source? Is it going to be a creative idea? Is it going to be some insight into a segment that's been different than what it was before, maybe through more models. We're looking at many more models than we ever did, predictive models and, artificial intelligence, data science, all those kinds of things, to just see if we can start to understand better what's driving behavior. And then you come up with, you develop these hypotheses. You don't start to say, well, I think it's because of, the economics of the situation. That's why people are doing this. And then we just proceed. It's like, no, that's my hypothesis. Now, what do I do to prove it or disprove it? And by the way, I've got 4 other hypotheses about what that behavior is causing. So we're not forcing, we're encouraging the agencies we work with to be thinking along those lines. And just like, we don't know the answer. We have to have a hypothesis to start with. And then you have to be really disciplined in identifying those hypotheses worth pursuing, that if proven correct, it's going to matter enough to the business. Because if you can be proven correct with something and then you find out, well, it didn't really matter. And I think that's a hard part too, because you're just estimating impact. And, I encourage the team to look at things like relative. I don't want to say it's $100 million impact when you do all the math. I just say, look, that's 100 million. One that's half as good as 50 million or whatever the numbers are. It doesn't really matter. It's about the relative proportion of those impacts. And you say, this one 10 times more valuable than that one. Yeah, okay. If it's 8, 10, doesn't really matter. It's much more. Let's pursue that one. So we've just kind of tried to get involved more in that kind of thinking because of this uncertainty. But other than that, we haven't veered off too much from what we normally do.
I agree. We're not doing a whole lot different, but what is unique and different is the tools and capabilities. Either AI was mentioned and machine learning, and how can that help us really kind of break through some of the data parameters and really provide deeper level insights. Beyond just our traditional market research, it's important to really understand behaviors and attitudes, and then how's that going to ladder up into your 2021 plan, and look at that investment opportunity. But it's also thinking through, do we need to pivot our messaging and how we're going to market so that we are being more relevant, more believable, more timely with our customers. And then there's, the back end measurement to ensure that we can adjust with more real-time optimizations versus, going just through the campaign front to back. What do we do along the way in the middle so that we can pivot as the market and the customers pivot?
How has your in-house expertise evolved, and is that growth or maturity impacting your work with agencies and vendors and such?
I think we are continually trying to learn. That's part of what I like to do with my team is are we getting better than we were before? And it's not just learning, of a new medium or a new channel or whatever. It's learning in things like behavioral economics and things that are causing behaviors to change. So I think that's a constant thing. The one thing that we are really encouraging, and we're starting to see some impact, is that the creative agency and media agency need to work together much more closely than they ever have. So it's not just this new channel. Now, what do we do? It's like, what's the right channel for this kind of message? Maybe a very emotional message or a very clinical message or whatever it is. There might be different channels that those are used for. I don't know that I could say, to tie it back to the question about expertise, we have knowledge in the space within our company. That's what we're looked for to deliver. I hope that's always increasing, that we're never just like on autopilot, just sort of doing the normal things, because no matter, that's what I said when I alluded earlier to pandemics. This pandemic has just accelerated things that were happening anyway. There are changes in the marketplace. This is a very different market in pharmaceutical marketing than 5 or 10 years ago. So you think ahead 5 years from now, what's it likely to be? Might there be many fewer reps or reps with different agendas, or maybe they have meeting, whatever, who knows what it could be, but that's the kind of stuff you start thinking about. And that's the expertise you try to develop in anticipation and not as much of a reaction.
I would definitely agree with that. I think as the pandemic is having our industry come together and collaborate to solve problems, I think we're seeing more changing the ways of working across industries with that support our businesses, and specifically where agencies might have competed before. We're looking at, what are the expertise to bring to the table so you can get the best product possible. That's a new mentality, and but it is having a good impact. I think also when you're thinking about what else is changing is the rate of data that is being consumed and ingested has changed our ability to be smarter in the marketplace. And I see a lot of, data as being the new gold rush for our industry. And then how do we leverage this in a smart way that impacts our customers?
We're starting to explore this more, of using maybe several agencies in the space, whether it's within predictive models or creative or use of behavioral economics, things like that, where you might think about more of a specialist to bring in, even within the agency holding company or something, not necessarily within the agency that you're working with, but maybe some sister agency or whatever, where they have an expertise that you really want to use. And we're just investigating that, so we haven't gone too far with it yet. But my understanding from talking to colleagues internally, that the key to success is you have to define the agency's role specifically. Okay, we're bringing in these other guys. They're going to work on this project from today through January 15th, and then their role is done. They're going to be responsible for this. You guys still own the whole, all that stuff. And being really specific about it can help you get, the right person in there to help. And I think, it's funny. I had some work done on my house with these construction guys with the bathrooms. Well, there's like these core guys doing the work, and then all of a sudden there's a glass guy that comes in, and then there's a stone cutter guy, and there's like all these specialists. They come in. There's more people coming in and out of this house. I don't even know who they all are, but they're very much specialists. And I started thinking about like marketing, like there's a role for that too. There's a role for the kind of the orchestra leader, the general director. But then there's like, I need a specialist with real expertise in understanding behavioral economics techniques and how to implement it, that is focused solely on that, where I don't know that I would have thought of that a couple of years ago. And so, you just bring them in, do their thing, they leave, and then the agency runs with it. The question will be, can the core agency handle that, right? I mean, can they handle the bringing in new people? And that's all about how, as a client, we would drive that. And maybe it'll work sometimes and maybe it won't, we'll see. But it's just something else we're thinking about that I hadn't really thought about before.
How are you using data and analytics to fuel decisions around HCP target audiences, selection of media channels, etc.?
Oh, wow. So it starts with the data analytics to ensure that you have the right channel and digital partnership mix. And I think the beauty of it, whether you're in a decentralized or centralized situation of how you encapsulate your data, is that you go back and you look at that information as you're informing your choices, as well as channel ROIs. And so when you think about, as I think about my channel and vendor mix and meeting their objectives, these KPIs beyond just open and click-through engagement rates, but how deep did they go into the video, and are customers shifting away from certain platforms and or vendors within the platforms, really inform our investment choices. It's one of those things where you really should go back and look at the data and how your customers are engaging to inform some of those newer choices. Now, if you have newer segments, you may do more traditional if you don't have as much data behind it. But if you have that data, definitely leverage it versus just collecting it.
We kind of look at a little bit of an art and science approach to this, because analytics, critical. You've got to know what's going on. We have models, we have attribution models and market mix models and all that stuff. But like any model is only looking backwards in time. It can't look forward without the sort of the subjective touch to it. So we look at that as a guideline and say, all right, we should be investing this percentage of the budget in this channel or whatever, and the total spend should be this. And then we kind of validate it based on past results. But then it's also, but wait a minute, but we're developing this great new creative that we think is really going to connect with we need to spend a little bit more there, or expand the reach a little bit to make sure we do this. Or our creative isn't that good, or we think it's not that it's not. You hope you never put anything in market you don't think is good, but you don't think it has the appeal that you might need it to have. So then you say, I'm going to be a little bit maybe more cautious in this spend, or something, or competitors coming into the marketplace, or something else you project might happen, either positive or negative, that cause you to adjust that spend. And then we have like biweekly. I mean, there's optimization going on daily at the agency, and then there's biweekly kind of meetings where you optimize the sort of the slower moving channels like email or something compared to things like search or banners, which are constant. So we can have a mix. And then we have a bigger meeting, less frequent, where you look at not just the clicks, but then, okay, they went to the site, how, like I think Lauren mentioned about how much of the video they view, ultimately then how much was their buying behavior change. So there's different levels of this. And I think it's really, we all know there's a ton of data out there, and it's how do you sift through and find out what really matters and discard the rest. Because you can get caught up into it and just find all these, these charts and data sets that are like, oh, that's interesting, but doesn't really tell you anything, and there's no trend to it, whatever. So that's a discipline that's hard to develop and then hard to maintain.
Actionable intelligence versus just a lump of data.
Yeah.
I think it's just to add, I think it's really important, when you're committed to digital, as many companies are, is that you do have this space of people or teams that actually kind of help you sift through some of these KPIs and ROIs. I agree there could be too much, but if you're focused on the right few based on that channel, you can probably come down with fairly good methodologies and models that kind of help guide your trends and where you're going to go in the future. I would also say, our customers, at least in the market that I am working in, all of them, where they're expecting to see the data is important as well, or see our assets or what we're putting into the market. So it's how do you think through meeting the customer where they are at the right time, right channel, because sometimes there's a decentralized approach versus just everybody going to our website.
Up until maybe the last year or so, the website was a separate initiative, like a separate team was managing it, and it was like that doesn't make any sense. Yet everything we're doing points to the website, and for the team working on it, it was typically a lower priority, so it wouldn't get updated as much. It wasn't as good. It didn't match the creative, all that stuff. And then we realized that's not a really good idea, So we decided we need to manage that and make it an integral part of the plan. So not only do you have certain campaigns, you have the website's going to be updated on these dates, and it's these number of pages and so on, and look to do a lot more testing on the website too, where different creative messages, different display designs and so on, that you can actually make that experience better. Because in the end, we're trying to create this experience that has value to the customers, that they're seeing this information that they really need, and what they're going to see next is what they need next. And how do we know this? We know this because we're doing all this work, all this statistical stuff, all the artistic stuff, and we're testing a lot, and we're ending up with just how did they know I needed to know this right now? That's what I want them to feel.
We'll be right back after a word from the Association of Medical Media.
Hi, I'm Tad Van Dijk, Executive Director of the Association of Medical Media, and we're thrilled that you've taken some time today to listen to this episode of our podcast series. For more information about our organization, please go online and visit www.ammonline.org. There you'll find a host of different resources and materials and tools that you can use. It's all part of our commitment to the medical media industry, and if you're inclined, we'd love to have you as a member. You can always reach out for ideas for new podcast series, or to let us know you'd like to become more involved by an email to help@ammonline.org. Thanks again, and we'll get you back to this interview.
We're back with Jim DeLash and Lori Hancock. Let's continue the conversation. We've talked about a few sort of new technologies. Have you made decisions or invested more during the last 6 months or looking ahead in new technologies or capabilities, meaning new since the pandemic, to help you inform those decisions?
I mean, there were things in the works, and we're always looking at new things, but I can't say there's been anything new since the pandemic. And things like telehealth, at least for me, aren't as valuable because it's a vaccine and we're not really, we haven't, telehealth is sort of the enemy, I guess, where it's that we can't vaccinate them over the computer, but, so no, but we haven't really thought about that yet. And it's interesting because new channels and like that's very tactical kind of thinking there, which you need at times. But as we face a pandemic and figure out what to do, I think we're trying to think more strategically about bigger picture. What are we trying to do? And are there new channels and new things that can help us get there? That's great. But we're not starting with that. We're sort of following with that.
Yeah, I would agree that many of these investments in newer technology and capabilities just don't pop up right overnight. We've been working on them for a while. What the pandemic has highlighted is how to pull them through faster, possibly, and get them into market so that we can, reap the benefits of new platforms and capabilities versus, starting just because the pandemic was there.
Is it almost the opposite, old school, like you think of something like direct mail, at least as consumers, we're all at home now all the time. One of the highlights of the day is going out to the mailbox. First of all, I get out of the chair for 30 seconds or something, and who knows what's going to be there. It's sort of like, 20 years ago. And I think there's an opportunity there because you have more opportunity. There's more availability of time and just to go get something. And even in a physician's office or something too there, I would think, they're, unfortunately for them, they may be seeing fewer patients. Something like the mail coming in may get more attention. So it's not necessarily just something a new technology. It's actually maybe the oldest technology that might be the one that matters most.
Are there new meaningful KPIs that come to mind that if you've sat in meetings and you're like, that KPI just keeps coming up, somebody from the data and analytics team just keeps saying it, that you're going to raise the level of where that KPI ranks on how important it is moving forward?
I think we're always looking beyond the traditional KPIs. I don't know that there's one specific new one at this point in time. But there are always variables that we're looking at around, how to better measure engagement strategies across our customers. It's always a little in flux, but once we land on something, I think the other thing is making sure that the model is reliable and statistically there, and then how do you launch a new KPI potentially. I would say, again, beyond open and click, we talked about depth, and it's really understanding how deep some of our customers are going based on the tactic is important. And also I would want to know, especially in this environment, how are we looking at consistency and frequency with our customers across the different channels? Because just like a representative goes into the door, it's not one and done with digital. You kind of have to have that pattern of frequency and consistency.
Two things that we've used differently to try to monitor what's going on. First is search impressions for our key AdWord groups, where if you look at, you start looking at, and in my world of physician behavior, are there changes in numbers of searches for different types of vaccines or seeing patients, whatever the words are, and is that's giving a sort of a leading indicator that if they're searching on those terms, that means they're interested in the topic, that we'll assume it means they're seeing patients, and that we can start to act, differently. And then we can drill into it, depending on the volume. It might be a geo thing or whatever, but search activity, I think, it's a natural behavior. So the more we can monitor that, it can give us insight into just what people are thinking. We use MVAs and HQVs as really key as KPIs. How's that for a bunch of acronyms in one sentence? But an MVA is the most valued action, and then a high quality visit. And those are both on the site. So you define those things very specifically. It's a video view, it's a download of something, it's time on site of whatever. We are also looking at modeling that sort of thing, where okay, it is a logic to it that says, if you go to the site and if you watch this video, you're probably likely, you're more likely to become a customer than if not. But I would love to be able to put some math to it and say, okay, if you do that, there's a 30% probability that you're going to become a customer or whatever. And then you can start doing some math that's going to say, all right, if I do that, and I can define and measure the value of that, that can help me go back and then determine how much I can invest to get people there. Because at 30%, and you do all the math and you say, okay, I can invest $30 a physician to get them there, or whatever it is. I think that's the kind of stuff that the different kind of KPIs now that are, because most of our efforts drive to the website. Well, what are they doing on the website? Because they're not getting all the brand information through the other channels. The website is the repository of all the information. So if they go and take the right actions, depending on where they are in the funnel and all those sort of things, that's where the probabilities come in. So those are the kind of things we're kind of playing around with right now to see if we can not become so totally analytics driven that you don't need us. You just have robots do this work. So you add the human element, which is what exactly does this mean, and what should the messaging change be, and what do we follow up with?
And last question, and then we'll open up for Q&A. New and social media. Laura, you mentioned this earlier. New innovative opportunities as we look to 2021. Lori, if you don't mind, can you share, have you shifted any focus to include or experimentation with new media and engagement tactics, podcasts? You've talked about video. Jim has already scratched telehealth off of their EHRs. What's new on the stove? What's cooking?
So I would say the shift to some of these channels, with the exception of telehealth, kind of happened pre-pandemic. And when I think of social, I think of it in two ways. There's the restricted HCP social through the Doximities of the world, and then there's the verge of going into like open paid social through Twitter and LinkedIn and Facebook, where I think we were at the tipping point pre-pandemic, and it has opened our eyes to say, what else can we do? Because we know some of our customers have shifted there, at least from our vantage point. And then how do we get the right information? Because through podcasting, through open social channels into the hands of customers. So although it was a pre-pandemic shift, we are, looking to, how do you open that aperture post-pandemic? I think telehealth is a tricky one. It's not off the list, it's just the how. And I think once we figure out the how in telehealth, because there's so many different disparate opportunities in telehealth, at least from an ad perspective, but there could be, how do we think more of partnerships in telehealth versus just paid advertising? So I think that's one that we still blueprint and think through on what are the opportunities, because I believe it will be here in the future.
Jim, any thoughts on new and social?
I'm probably one of the outliers. I'm not as bullish on it as other people are. I think it's good. It's helpful. There's an opportunity. I'm just not sure it's big enough. And it's also much more time intensive internally, to get things approved. And it's a little bit, so you have to value and evaluate your team's time and the agency time, as well as the cost. So is this going to be worth the effort of going through multiple iterations of review for something that maybe it yields something, maybe it doesn't, versus other things that we could be doing? So I do look at it. If it fits our strategy, then we should do it. But I don't want to just do like something on social just because leadership says we need to be doing more social, and there's some chart somewhere that says X% of our budget needs to be social, which I think happens at times.
I think it depends on your customer base, and if your customer base is there. If your customer base is there, there's the opportunity to crack the social network and provide a new aperture of channels. I do believe that it's not a lift and shift of content. You really have to think about like native platform content and how to do that right in the channel so that you show up credible, believable, and people want to engage with you. And so that's a good thing to work on that you can do without 1,000 iterations.
100% with that. That's where we've had success in some of our other non-vaccine brands on social, is developing content, most comfortable within the Facebook infrastructure, and not just technically, but that it's a different way of of communicating the message, because it isn't just put the same message that you would put in a physician's journal or something on Facebook or Instagram or something. It has to be done differently. And in some cases, we're willing to put that effort in other cases, we haven't been, in which case we won't advertise there. We don't want to just put the same old ad there because it's not going to work.
Great. And we'll kick off the Q&A portion with a question that dovetails nicely from Dana Trimborn. Have you used any ads recently within health podcasts that would be relevant for the physician to not only listen and gain knowledge, but to also hear a sponsored ad for a product?
We have advertised on podcasts.
I don't know that we've advertised a product on podcasts. I think we're looking to produce. How do you think of producing your own podcast so that you can get a listening audience is really on the lines of most, versus being a sponsored ad in between podcasts, so that you can have that one-on-one dialogue.
From Christine Perino, how are you leveraging personalization to increase relevance of content, message, experience to your customers?
So I would say, A, hi, Christine. And B, I think leveraging personalization is important, so that there's a bunch of ways you can do this. There's technology that helps with personalization, understanding right channel, right message, right time at that moment for the customer. Some people call it next best action. Some people call it next best engagement. There's all kinds of tools out there. But I would also say is, going a layer deeper is, how do you start to think about the persona work that you're using and developing and portraits or digital customer portraits with our customers, and making sure that that is personalized, so that, Dr. Hancock gets a certain type of subject line that's an infographic that goes with right message time based on how I have been interacting with content in the past, versus the next doctor could be Smith, who has a more integrative persona on subject lines, but a different type of maybe more clinical versus infographic. And so I think when you get to that point, you've really met your customer preferences, and you're able to still give that message, but display it in different ways across your segments. And so that's the exciting part.
We've done little in the way of using personalization, and I think there's a huge opportunity there. It's, and I think it's a lot of testing and learning from that, because, I think from what my research into personalization is, people are not offended by personalization as long as it's relevant to them and has value to them. So if I tell you, I know you've been buying this many products from us, and based on some other information we have, we think you may be able to serve more patients if you, with an extra number of doses or whatever, there may be value in that. Or there's other things that we might use the data that we have to create a more valuable message for the customer, and not just tell them what we know about them, but turn that into value. Otherwise, it's just like, okay, you're telling me what I already know. I think through things like Amazon and other that we all buy through, we know that they know our buying history, and we actually want to be reminded when there's certain things that we've been buying but haven't bought lately. Whether we choose to buy or not is a separate question. Why can't we do that more? We noticed your buying, your pattern has changed in buying. You used to be buying a lot more. What's the right message to address them with? Is there something we can do? Do you need to talk to somebody or whatever, instead of just totally not using that information to the customer's benefit, because maybe there's some reason that they're not buying, and there's something we can do about it, or maybe there's not. At least you come up with some hypotheses to prove it out. But I think there's so much data that we can use to make it a better experience. We just haven't, and I think we're heading that way. But I get the feeling it's going to take a while. I'm not sure why, because it's pretty obvious to me.
Yeah, I would. Just to add to and build upon some of those comments, is I really think personalization is, I want to say, the wave of the future, but it's a really important capability to bring into your digital strategy. There's a blend, or starting to get a blend, especially now, between what your expectations are in your personal life versus your professional life. And, some of the real-time demands of that you can get with personalized messages are starting to dribble and drabble over into the professional life as well. And so I think the more we kind of think about that space and how to, capitalize on that in the future is going to be really key for us.
A question from Milton Barkos. Outside of ATUs that you share with agency partners, do you also share the actionable results with agencies to determine if multi-channel programs are successful and tied to your long-term KPIs?
Yeah, we have the agency partners are involved they attend all the analytics meetings. It was surprising to me a couple of years ago when one of the writers at our agency said, yeah, he's never even seen the results of how these emails worked out. He spends all this time developing subject lines and goes through all the, the review and then doesn't even, I thought that's crazy. We can't do that. So yeah, no, we have these biweekly meetings. I mentioned the agencies are all invited, media agency, creative agency, database, anybody involved.
Yeah, I would agree. You have to create that space and forum for the, not just the media agency, but the creative agency and anyone else that's been touching that digital content, including marketing. And when you have this, diversity of people invested in the digital content, it's important for them to understand why you're making certain recommendations and why you're pivoting based on the data and how things are performing. And they want to know because it just helps them do a better job and helping us kind of create, what things could look like in a compliant way.
That's all for this episode of AMM Conversation. AMM Conversation is the official podcast of the Association of Medical Media. A special thanks to AMM board member Amy Turnquist for coordinating the pharma panel guests. Make sure to listen to each and every episode of AMM Conversation on Apple Podcasts, Google Podcasts, Stitcher, Spotify, or wherever you enjoy your podcasts. Kindly leave us a comment, subscribe to the podcast, follow us, or share the podcast with friends and colleagues. We appreciate the engagement. Also, make sure to check out the AMM website, ammonline.org, for the latest information and resources on medical media. In addition to fact sheets, industry research, and special reports, you can watch my monthly healthcare policy update featuring Beltway insider John Bigelow, or the new YouTube series, John Laughlin Viewed Your Profile, on AMM's new YouTube channel. Thanks for joining us today. The views, thoughts, and opinions expressed in this podcast belong solely to the guests and not necessarily to the host or AMM or any other group or individual.